I'm Rodrigo Alves. I'm 32 years old. I live in London as well as Spain. You might remember from last year.
For me to do your nose properly, I would have to take a piece of rib, a big scar right on the chest.
8-pack.
Well, a little bit higher, but yes,
Never.
an 8-pack.
No, you don't touch it. I paid a lot of money for this.
As you can probably tell, I have changed a little bit. Well, it's slightly upgraded. I have had my nose done 3 times, the brown lift, an eye lift, my jaw reconstructed again, silicone chin implants, my ears pinned back, my chest silicone implants replaced. I have had 42 plastic surgeries and I have spent 305,000 English pounds, the equivalent of $450,000. I found out that Iran is the country #1 for nose job. I got a visa, jumped on a plane with my 2 girlfriends, and then we went to Tehran, Iran. 7 days after the surgery, when the doctor removed the cast from my nose, I looked myself in the mirror and then I started crying. Crying of happiness, because that was the man that I was meant to be. I was in a very good place, but unfortunately, that didn't last for too long. First, I started to see a dent on the left side. My nose started to get tighter and harder to breathe. I live a very busy lifestyle, still living the life, being the party boy. Nothing has changed, apart of the fact that now I am actually botched. So why not come into Los Angeles and see Dr. Nassif again? That will be my 7th and last rhinoplasty, and that will be it. It feels great to be back in LA. I'm very excited to see my friend Carly. She's gonna be very surprised to see the new me. Hello. Morning. Had a lot of my work done, and I think that she's gonna be a little bit like, wow, you changed. Hello.
Hello, Rodrigo. How are you? Look at
Wonderful
you.
to see you. Look
my
at
goodness.
you. Yeah.
Wow, you
Look at your hair. It's beautiful.
look so different. I'm definitely shocked to see the way that Rodrigo looks now. His whole face overall just looks like he's had some more procedures done.
As you can tell, I have had more work done.
Well, you look amazing.
I had a brown lift,
Okay.
an eye lift. Then I had my chest implant replaced, as you can see. It looked
So you're gonna be bigger.
From 140 milliliters, now I have a 240.
Ooh, sexy.
Yeah, I love that.
I didn't want to make you uncomfortable, but I have to ask, like, what happened with your nose?
I got a bacterial infection.
Oh my goodness.
If I could turn back in time, I would have accepted Dr. Nassif's suggestion to do my nose. If I have had that done with him there and then, I would not be in this situation right now. So I'm hoping that Dr. Nassif be able to say, yes, I'm able to fix your nose, and hopefully by next week I'm gonna be able to breathe again.
And that'll be it.
Yeah, and that'll be it.
Beautiful.
Thanks to plastic surgery.
Thanks to plastic surgery.
So what do we have next? So we have a patient that we've seen before from England, across the pond. Remember Rodrigo?
Yes.
He wanted me to make his nose smaller.
Right.
And I said, well,
Yeah,
I can't. I'll help with your breathing. Let's put some rib in. And you freaked out. No,
Right.
his rib looks great.
Right.
So apparently he's had surgery. And I do have some photos. Oh, his nose is
Smaller.
smaller.
Way smaller.
Oh. Rodrigo's skin, it's destroyed.
Guess who's back?
Rodrigo!
Hello.
How are you, Rodrigo?
I am well. It's wonderful to see you
How are
again.
you, my man?
I'm very confident that Dr. Nassif and Dr. Dubrow will be able to perform a very simple, quick procedure, and then I'll be able to breathe again and gain the perfect little nose.
What we remember is you wanted to have more of a style, a little bit slimmer, sleeker nose, and you had a problem breathing. And I said I couldn't make it smaller, but I can fix your airway, and I needed a piece of rib. And I remember you had some sculpted, beautiful abs, and you said, no scar here.
Ever since I have had 3 rhinoplasties since we met.
Wait a minute, We just saw you less than a year ago. 3 revision surgeries in 1 year? That's crazy. I can't believe he even still has a nose. It takes 1 to 2 years just for your nose to heal after 1 surgery.
I found out that Iran is the country #1 for rhinoplasty. The doctor, in order to perform the surgery, he used cartilage from a bank donor.
Cadaver bone. Cadaver cartilage.
Cadaver cartilage is sometimes used for the nose when you don't have good cartilage from the actual individual. The problem with cadaver cartilage is that it's not specifically for that individual, and the chance of it reabsorbing or being attacked by the patient's own immune system is elevated.
After a month, my nose started to become smaller and smaller and shrink. I went to see a doctor in Spain. The doctor said, well, you have a bacteria.
Most likely the type of bacteria that I see that eats cartilage way in the nose, it would be called MRSA, methicillin-resistant Staph aureus. And that is most likely what you had. MRSA can enter the bloodstream and called sepsis, which is bacteria inside the blood, and pretty much shut every system down in your body and kill you.
The fact that you've had so much surgery in the past that you basically disrupted so much of the blood supply and then put a piece of dead tissue in that caused the whole thing to die.
Well, let's go examine your nose.
Let's do that, doctor. Thank you very much.
Okay, I'm gonna put your head. Hey, can I have that speculum?
There you go.
There's no way that's gonna fit in his nose. Put your head back for me, all the way. Nope, I can't see in there. And nope, I can't see it there. Here we go. His nostrils are so small, and after what he's gone through with the MRSA, this is probably one of the worst results and complications that I've seen in my entire career. All right, so let's talk about your nose.
Yes. I feel like crying right now, but I'm trying to...
Okay, I need you to be strong.
I'm holding back not to cry.
Listen, the thing is,
Because
Rodrigo,
I'm actually very extremely worried. That's why I'm here.
the issue is that what we call the soft tissue envelope. That's the skin.
Right.
So by you having 3 surgeries in a period of 12 to 15 months, destroyed your tissue, the skin's no good.
My nose was perfect after this last rhinoplasty. And my friends, they never had any problem at all. And I was the unlucky one. So I keep asking myself now, why me?
Your nose on the inside, you have no airway. And it's short, so this is all scarred together. And now since you just had surgery 3 months ago, it's gonna scar down more. It's in a healing phase. If you try to insult your skin one more time now while it's healing,
Yes.
there's a high possibility that if you let one of these doctors touch your nose now, this will turn black and then die and fall off. Our goal is to educate patients and protect them. The smartest thing that Rodrigo can do now is listen to us.
Wow, doctor, so it's much more complicated than what I actually thought.
I have a little bit more news for you. So, besides using rib, the skin here from your tip down to here is contracted. So we have to replace the skin. The simplest way is to take this tissue here and lift it up and reconstruct this area. And you'll have this piece of tissue attached to here, because that's where all the blood supply is, for about 6 to 8 weeks.
I'd rather be botched and live to the rest of my life if I know that doesn't work and just breathing through my mouth than look like Frankenstein.
If you have any hope of keeping your nose, we're as serious as a heart attack, Rodrigo. You touch your nose now, the chance you're gonna lose your entire nasal tip and possibly more of your nose is extraordinarily high. So do not do anything for a year. Nothing. Chances are that his nose will die and fall off. If he doesn't listen to us, it's game over.
Listen, Rodrigo, we like you. We want to help you, and we will help you. But you have to wait a year.
I will wait a year to
man.
see you again.
Yes.
Yes.
we'll
And
take care of
No more surgery.
it's a little bit frustrated going back to England knowing that I wasn't able to get a solution today. But I just need to find ways to live with it now, and 2, I'm ready to go through another operation to fix the current issue. What have I done to myself, honestly?